So what are the prospects for value-based care under the Trump administration? Congressional Republicans and the Trump administration continue to grapple with how to improve the healthcare system, and they're thinking about repealing and replacing the Affordable Care Act. In that debate, in their consideration, issues of coverage and access are the dominant ones. So a largely unasked question is, what will happen to value-based care? Now, that's an important question because our nation spends $3.4 trillion in 2016 on health care. To put that number in perspective, it's $10,000 for every person per year. And guess what? CMS projects that in the next decade, healthcare spending will grow faster than our gross domestic product at a clip of 5.6% per year. So in 2025, it's projected we will spend $5.5 trillion in healthcare, and that will gobble up 20% of our GDP. That's just not sustainable. Now, the Affordable Care Act had a number of different health care delivery reforms. These are major reforms, all of the value-based care variety. And the purpose of these were to help reduce the cost growth and to improve quality of health care. There are 5 health care delivery reforms in the Affordable Care Act: the Hospital Value-Based Purchasing Program, the Hospital Readmission Reduction Program, the Payment Adjustment for Healthcare Acquired Conditions, the Bundled Payments Pilot, and the Medicare Shared Savings Program, ACOs. These 5 are very significant. They're all value-based care, as I mentioned, and what that means is they use economic carrots and or sticks to improve the quality of care and to promote reduced health care costs. Now, in addition to that, the Affordable Care Act funded what's called the Center for Medicare and Medicaid Innovation, the Innovation Center. And the Innovation Center's purpose was to develop, test, and evaluate various payment and delivery reforms, all to an eye to increase quality and to reduce cost. Most of these programs were voluntary, but a few were mandatory. Now, Secretary of Health and Human Services Tom Price has been somewhat a critic of the Innovation Center, and in particular, he's been opposed to the mandatory programs of the Innovation Center. That being said, the rise in healthcare spending is so great, it threatens the sustainability of our entire healthcare system, so much so that congressional Republicans and the Trump administration have no choice but to embrace the value-based care movement. Given the structure of our U.S. healthcare system today, value-based care constitutes our best path forward for reducing healthcare costs and improving quality in the future. What will drive increased healthcare spending for years to come, and what will restrain healthcare spending in the future? In February of 2017, CMS issued its latest national health expenditure projections. It showed that in 2016, the United States spent $3.4 trillion in healthcare, and that's $10,000 per person per year. Moreover, CMS projected that in the next 10 years, we're going to be seeing healthcare expenses grow faster than the rate of our inflation. So it'll be growing at 5.6%. In 2025, we will spend $5.5 trillion in healthcare, and that'll be 20% of our gross domestic product, up from 18% in 2015. So an obvious question is, what's behind this growth in our healthcare spending? In simple terms, it's a combination of increased prices and increased consumption. On the pricing side of the equation, medical prices, driven in particular by higher wages for healthcare workers and rising prescription drug prices, will grow faster than our rate of inflation. On the consumption side of the equation, CMS projects that we will have increased use and intensity of services as our healthcare system tries to meet the increasing needs of our baby boomers. The baby boomers are going to be dealing with chronic conditions such as hypertension, which afflicts 75 million Americans, and diabetes. 29 million of us, 1 out of every 11 Americans has diabetes. The thing about diabetes that's scary is that 86 million of us, over 1 in every 4 Americans, are pre-diabetic. Diabetes alone portends increased healthcare spending in the future. So while the debate about access and coverage in Washington continues to swirl around us, the issue of cost is something that has to be confronted. And value-based care really is the direction we need to go as a nation as a whole. Value-based care, now the question is, what's a good example of that? And I want to share one example, which is Colorado's Accountable Care Collaborative. This is an initiative that's time-tested, proven, scalable, and very effective, very successful. The Colorado ACC, Accountable Care Collaborative, is a Medicaid ACO that serves over 900,000 enrollees in that state. It emphasizes preventive care, it applies population health analytics, it improves care coordination. As a result of that, they've been able to reduce ED visits, they've been able to increase postpartum care, and increase well-child visits. And the bottom line is the Colorado ACC has saved money year after year after year. In 2015, the ACC saved $37 million. That's $3.43 per person per month. That's a very impressive amount. So using the Colorado ACC as a bellwether, as a guide, that's where we need to go to reduce healthcare spending. We need a value-based care approach, we need a population health management perspective, and we need improved coordination of care across the entire care continuum. So in short, how can we reduce healthcare spending? We need innovation, application of technology. We need education of caregivers as well as patients. And we need application of behavioral economics.